Day, and 2024 marks a decade since the launch of the initiative. The growing demand for equal enjoyment of fundamental human rights as well as appropriate accommodation for persons with albinism is an ongoing issue that can't be ignored. Persons with albinism face unique challenges and discrimination from social stigma, marginalization, and exclusion, which hinder their ability to further participate in society and exercise their human rights. To address this issue, it's become essential to recognize and respect the inherent worth and dignity of all individuals, regardless of the physical characteristics. The Albinism Association of Nigeria today marked the 2024 International Awareness Day, marking a decade of collective progress. I'm joined by Tolani Ojuri, who's Chairman, Albinism Association of Nigeria, Lagos State Chapter. Mr. Ojuri, thank you for joining us on the news this hour.
Thank you very much for having me.
So, has it really been a decade of collective progress? I want you to speak to us as regards some of the significant milestones and achievements you think has been achieved in the past decade.
Well, in Lagos State, it's been a decade of collective progress. It's been a rough road. We traveled a very, very rough road, but we are there. We are getting there. It's been the thematic areas. We talk about health. We're talking about education. We've made significant progress. Persons with albinism, apart from the low vision, another major problem we have is our skin. Because, we don't have the protective layer of the skin, so we are very open to skin cancer. Up till last year, we had an average of 1 death due to skin cancer in Lagos for persons with albinism. But sometime early this year...
1 death per year?
Per month.
Oh, per month?
Yes, of persons with albinism in Lagos due to skin cancer. But this year, January this year, the Lagos State government stepped in and through a special intervention, as I speak with you, we have 12 persons with skin cancer being taken care of by the Lagos State government. And we move further from there in the area of awareness and prevention. They're now providing sunscreen for persons with albinism in Lagos. They're providing caps, providing umbrellas for persons with albinism in Lagos. That's in the area of health. And we have a wonderful working relationship with LASUT, that's the Lagos State University Teaching Hospital, the skincare clinic. Persons with albinism are always encouraged to go there and have their skin checked every 90 days. Provisions have been made there as well by Lagos State government for pre-cancer cream, because skin cancer can really be taken care of. It's not as deadly as that if you catch it very early. And that's why we always encourage people to, persons with albinism, to visit Lagos State Teaching Hospital at Ikeja to have their skin checked very often.
Is it for free?
Well, you have to get a card and register. That's for, I think, 3-5 or thereabout. You just get a card. But, the pre-cancer creams are there. The dermatologists are, because check, double check, we check. We would rather spend 3-5 to go check than spend 5 million, 10 million to treat a patient with skin cancer.
Lagos per month last year.
Yes.
And that is Lagos where we expect that things are far better.
Yes.
We can only imagine what's happening.
What happens in the southeast, south. People keep saying, oh, Lagos is a center of excellence. Yeah, it didn't happen by magic. We really engaged Lagos State government. We engaged them. And what is happening now in Lagos is what other states, because we have a national policy on albinism, and what we have in Lagos State is what we want them to adopt at the federal level. It is cheaper for the government in the area of prevention, in the area of awareness. It's cheaper for them rather than treating cancer. If we can treat the cancer cases we have now in the next 12 months or 24 months, then you will have almost nil or very, very minimal number of persons with skin cancer. If people are aware that they have to protect their skin, not just persons with albinism alone, the general public should definitely know. If you see a person with albinism, always tell them to go check their skin. If you see them looking funny with patches on their skin, they're looking so red, tell them to go to the hospital to have themselves checked. Unfortunately, we don't have so many dermatologists, but the ones we have in Lagos State have been very, very wonderful. That is in the area of health. Other areas, education, transportation, area of business, well, I mean, that too, we've made major progress in Lagos.
So despite the progress you think we've made in the past decade, what do you consider the most pressing challenges individuals with albinism in Nigeria continue to face?
Stigmatization is one.
It's still there.
The low vision is two. I can sit here to talk to you because I've got my photochromic anti-reflex glasses on. Most persons with albinism can't really, because they try to dodge the light and all that. And due to this low vision, the rate of school dropout for persons with albinism is very high. Yeah, in Lagos again, we partnered with an NGO, Save the Children's Site, for every child with albinism from age 0 to 18. Once you show up, you get a photochromic glasses. Okay. So that had been able to, because if you are not well educated, if your level of education is low, you'll be forced to do menial jobs which exposes you to the sun. So we felt, okay, if we can take care of the education aspect at a very early age, you will have well-educated persons with albinism who won't have to expose themselves to the sun. So that is a major, major challenge. If we got that right with Lagos to a very large extent, if we can get that right all over the country, then that's a major leap forward for persons with albinism.
In terms of policy and advocacy, what kind of changes do you think will be fundamental that government has to begin to pay attention to on a national level?
On the national level, there has to be a spread. Of course, we have cultural differences. What goes in the southwest is not what goes in the north, is not what goes in the east, and the numbers are different. Yeah, we are a very interesting country. From the little I've seen, I've had cause to do projects with Jonah Pede and all that. In some areas, they believe they are gods, I mean, they're spirits, and in some areas, they just feel. So you have that. But across board, if, I mean, there's a law, the national law on person with disability. That law also covers persons with albinism. If really we could get a bill that forces people to go check their skin. But however, we live in Lagos. Lagos is quite small. I can travel from Ajah to Ikeja, which is quite far. But in some areas, for you to find a teaching hospital, it is very far to where they live. So that taking the issue of healthcare for persons with albinism, it's a major issue. And the area of disability extra cost, that's the cost that comes in, that the cost you incur by buying the sunscreen, getting the glasses. If the government, if the federal government can take care of that cost, then the life of persons with albinism definitely would be much, much easier. This cost is what we're trying to identify for everybody across board. Either you live in Sokoto, or you live in Kano, or you live in the South House, or you live in the Southeast. Once the disability extra cost is taken care of, and we have systems in place, then, I mean, I always tell, government functionaries that it is cheaper for you to prevent these issues, take care of them. Early intervention is very important instead of treating the effects of it.
Hopefully that with this observation, the observance of today, there will be more community support and solidarity, and we're also going to see government doing more in this regard. Tolani Ojuri is Chairman, Albinism Association of Nigeria, Lagos State Chapter. Thank you so much for talking to us.
Thank you very much for having me.